One of the things that smaller companies and medium-sized companies need to figure out and overcome in order to scale to the next level is going to be this continuity within their entire system. Because otherwise, they're always going to be running into a lot of little problems and trying to spot fix them with more random stuff from more random places. And it might put a band-aid here and then create a gashing hole here. Hi everyone, my name is Mariam Treystman from the Home Health Consultant. And today we're going to be talking about system continuity. But first, if you like our content, please like, share, and subscribe. So, what is system continuity? Well, first and foremost, it's a giant problem in the industry. Over more than 2 decades, I've been, doing consulting and things like that. And one of the things that I've noticed as a rule, not an exception, across companies all over America is that they will often, through no fault of their own, take pieces of resources, forms, I don't know what, from all these different companies and places, or maybe make one form, then take 2 things from here and buy stuff from there, and so on. And ultimately, that leads to a lot of unintended problems. But first, before we dive into what this big problem is and how it occurs, let's define what a system is. To us, a system is essentially how your entire company functions. This is all of the components of your company that come together to make up the end result, which is your patient care. This consists of your programs. The programs are essentially just a bunch of policies, procedures, forms, activities, whatever, just whatever it is that you do and use to achieve a certain outcome. Then you have policies. Those are your policies and procedures. And these are step-by-step instructions pretty much on doing a specific task. After this, you have forms. The forms in your system are there to capture important and critical data or critical process steps. And we also have Inservices. This is educational material for your staff. You have audits, such as chart audits or HR audits, right? These are essentially forms used to capture a process, but they are specific to ensuring that the process is done correctly. And of course, lastly, we have patient-facing information. So this is going to be documentation or, whatever teachings, whatever it is about rules and regulations to ensure that they receive compliant care, relevant company processes so they know what to expect, terms of the relationship between the agency and the patient so that they know what they're responsible for, what the agency is responsible for. And of course, health-related information and teaching so that they know what to do in various situations related to their health. The problem that I have seen, both recently and really throughout my career in home health and hospice, is that people will take all of these little components from various different resources and places. So maybe the forms are within their software, or most forms are in the software. Then you have Oasises from Briggs or MedPass or whatever. Then you have policies from Corridor. Then you have, some other kind of programs, maybe from this consultant or they from themselves. Then there's patient-facing information that we found this one teaching online and then this other teaching online. The in-services come from Red Cross or I don't know, random kind of collection of places and so on. And that's not wrong, but it's not a best practice either. The reason that this is a problem and why these things need to go together is because all of these different components, right? The programs, the forms, the policies, all of these different things, they are all there to capture a different aspect of the same thing. And so if they come from different places and different sources, you're going to have a mismatch of the information and process steps that they are describing and capturing and whatever, right? And so if you have, for example, in your admission packet, you have your patient brochure. The patient brochure or the patient book or whatever you want to call it, the big kind of collection of paperwork that includes like the transfer and discharge policy that you need to give, whatever. When you have that book, it's supposed to contain a lot of patient-facing information about your company's processes, policies, da da da, things like that. Well, those things in there need to match your policies and procedures because you're essentially showing the patient what your internal processes are for various things. Of course, there are other things there, right? There are other resources for them and stuff like that. My point is, they also include a lot of things that are your processes and policies. By law, you're supposed to put them in there. Well, they need to be actually from your policies and not like just any policies. So the policy in the book, there needs to be some overlap with these. Not all of it, but some of it, right? And then also, for example, in your admission package, you have forms. These forms are supposed to capture certain data and process steps that are described in your policies. Well, if your policy says you're collecting this data, but the form in your software doesn't ask for this data, and so pretty much the clinicians are not just naturally collecting this information that your policy says you're going to collect, or not doing this step because it's not included in some checklist in your admission, for example, your admission document checklist, but it is included in your policy. Now you have a problem because you're not following your policy. The same can be said for, really anything, like, for example, your fall program. Well, if you get your fall program from just some random place, and then your patient book has other info about falls, now your fall program has different info, your policies have different info, your patient book has different info, and now you got the in-service from somewhere else too, and so you're training your staff on different info. Now, every place that you reference something for has contradicting information or insufficient kind of steps or whatever. And so there's no way to have any kind of proper structure or form when the policy is different from the program, is different from the book, is different, that's patient facing, is different from the forms that collect the information for it. So what you're really doing is your best, obviously, right? But like doing that is like self-sabotaging. And essentially the companies that end up growing to a larger level, one of the things that smaller companies and medium-sized companies need to figure out and overcome in order to scale to the next level is going to be this continuity within their entire system. Because otherwise, they're always going to be running into a lot of little problems and trying to spot fix them with more random stuff from more random places. And it might put a Band-Aid here and then create a gashing hole here. So we really need to be careful with where we get our materials because they could be individually compliant, but not working together as a whole to create a positive result. What can happen when this is the case, when you have just like things from all over the place? It could cause survey deficiencies and even possibly survey failure. So how does it do this? If you've been in enough surveys, you're going to catch on to the fact that it's rare to get one deficiency. Oftentimes, your one deficiency becomes two deficiencies very quickly. Because anytime a surveyor is going to identify a problem, they're also going to immediately, like, put a timer, 10 seconds or less, ask you for the policy of that situation. So for example, if the surveyor identifies a medication error or something, right? Like some mismatch or whatever, they will ask you for your medication policy. And then they're going to check if you followed the policy. And of course, if you have the medication error, you probably didn't follow the policy, because if you followed the policy would explain how to make sure you don't get that error. So now you have two deficiencies. You have one for the error and one for not following your policy. And so these deficiencies just rack up with the inconsistencies. And that's like the smallest problem that you can have. Literally, if the worst thing that happens is that you get you didn't follow your policy deficiency, then like ignore everything I'm saying and just move on with your life. Like go to the next video. But the next kind of like important thing that can happen is that you can have a critical care error. A lot of times people, especially people who work in the office of an agency and don't do the field stuff, right? Because the office staff is very removed from the actual patient care. Like in a hospital, the office staff, the administrative staff is also, they're in the same building as the patients. So you kind of have more of the internal weight of understanding that this is healthcare, patient care, da da da. If you are in the office environment all the time in a home health situation, it's very easy for all of this stuff to just become like kind of a name on a page. Just something you have to process, whatever, right? And so when we talk about the surveyor finds a medication error in the chart, right? That means that there could be an actual treatment error or some kind of like health-related consequence to a person at the other end of this treatment. And so depending on what the issue is, having these random forms and things and whatever, a lot of times people will even, for example, the software has all the forms, right? But they don't like the Oasis forms, or they don't like the comprehensive assessment. So they use some paper forms from here and then whatever. If you're capturing certain things on this form and not on this form, the things you're capturing, let's say on the Oasis or on the the comprehensive assessment, home health and hospice, right? Comprehensive assessment. If there's no space for it on the care plan, chances are you're going to miss putting it on the care plan. This is like, if this whatever, make up the example. If this whatever element doesn't transfer into the care plan, besides the deficiency at survey that you are not doing individualized plan of care, that you're not addressing all problems, whatever, right? Besides those deficiencies, you're not addressing this problem or whatever this is, right? And so this could lead to critical care errors, especially if it's like medication stuff or like you're not reconciling, or there's new meds or meds that have, problems with each other, things like that. The next level of issue, and I'm not trying to like put them in some kind of hierarchical order, but to me, the survey deficiency is the lowest level problem you can have. I think critical care errors are, of course, so incredibly important. And this could lead to ADR rejection. It leads to ADR rejection because you are not presenting a continuous picture from this form to the other form. The staffing company uses their own random forms from their own random software, this, that, whatever. And that's like, are the forms good? Is the software good? We don't even know, right? Like the software forms or whatever. My point is this lack of continuity between the clinical health information stuff, that could lead to ADR rejection if you are not addressing, let's say, for example, eligibility criteria. I'm not talking about the face-to-face or something where it's like it's there, it's not, more or less. But like, okay, let's use home health as an example, homebound status. There might be certain things you're checking for homebound status in this form that don't have it in the remaining follow-up notes or whatever. Well, that might be the critical thing that justifies your homebound status if you're not continuously justifying it throughout the episode. Now, at some point, it drops off. And so the ADR can reject for eligibility criteria or medical necessity or whatever, these vague terms. But that's just because you haven't been continuously justifying this stuff over the entire episode, because your forms are random and they all have random things. And then people wonder why ADRs get rejected. I mean, Of course, there are also like real reasons, not just continuity reasons that they could reject. But I'm just saying that's a big factor as well. And lastly, some legal issues can come from it. Of course, like God forbid, like we hope that doesn't happen. But if you miss a critical step that's not according to your policies that results in some kind of like injury or death of somebody, now, I don't know, like family can come after. I don't know. You know what I mean? Like things can happen. My point is that it's very important to make sure that your general system all goes together. Because even though they are seemingly random and unattached to each other, like, okay, the policy says complete a comprehensive assessment. Okay, I have a comprehensive assessment. Yeah, but then like the next, 1A is like all the things that should be in there, and they're not in here because you got them from 10 different companies. So just things like that. You really want to make sure that everything speaks to each other. Of course, in our administrative compliance program, we made sure it does. I mean, I wrote most of it myself, and with the intention of all of it vibing together, and especially with the rules. Because one of the things that we can't just pull from wherever we want, I mean, I guess we can in the choice of a creditor, is like what rules we're compliant to, right? And so all those things also have to match the regulations. So my point is, when you are looking for, oh, I need a fall program or emergency plan or whatever, if you're thinking of just like purchasing things and whatever, just make sure that you're getting them from the same place. If you have access to something from one place, then try to use as much of it as possible because it's just generally going to jive better with the whole system. And like I said, the level up to the next level of your company is going to be contingent on your ability to solve this problem, because this is going to be a root cause for all of the things we just discussed: survey deficiencies and possible survey failure, critical care issues, ADR rejections, and legal issues. If you're dealing with these 4 problems on a day-to-day basis all day long, you might want to ask yourself, could it be that all of my resources like don't match each other? So that's that. If you like our content, please like, share, and subscribe. And again, my name is Mariam Treystman from the Home Health Consultant, and that was about system continuity. Thank you.